Hello and welcome to the Health Detective Podcast by Functional Diagnostic Nutrition. We bring you interviews from people who have conquered the trickiest of health challenges using the functional diagnostic nutrition philosophy and similar healing modalities. You're going to hear from experts who have been through the ringer with their health issues and yet managed to come out on the other side. You can always visit us at functionaldiagnosticnutrition.com, but for now, here is today's episode. All right. Hello, my friends, and welcome back to another episode of the Health Detective Podcast by Functional Diagnostic Nutrition. My name is Evan Transu, aka Detective Ev, and I will be your host for today's show. I don't even think our guest realizes this yet, but it's a very special episode because this is number 400 of the Health Detective Podcast. Somehow they've kept me for over 4 years here. I appreciate it, Reed, Brandy, and the rest of the team. And it actually ended up working out super well because I think this is not only a very important topic, but it's a highly credible person to discuss this topic. So we will get into that soon. I see quite a few of you popping in live already. As always, around the 30-minute mark, we encourage you to ask your questions. You can also throw them in beforehand as we're talking, and then I will prioritize them once we get to that 30-minute mark. With that said, a few quick updates. If you guys like the nerdier content on this show, especially when we do lab and learns and those types of things, we have one of our favorite workshops coming up next week, starting February 17th. It is called our 5 in 5 workshop. This is where we walk you through a live case study. So we take someone who has a bunch of health issues going on. We actually have their live lab results, and we analyze them live, one each day, followed by an hour of Q&A for you guys. So we'll be doing stress and hormones panels, GI maps, food sensitivity tests, all this fun stuff, at least fun to people like us, right? And we will be going live every day at 1 o'clock Eastern time. And if you can only catch 1 or 2 of the days live, that's fine. It's designed in such a way because we know people have jobs and not everyone can get on for all 5 days. Replays are available within 24 hours of the workshop being done or that day being done. And you will have permanent access to everything in the workshop. So you can find that at fdntraining.com/5labs 5 days. That's fdntraining.com/5labs 5 days. Only other quick announcement is we do still have tickets for the East Coast FDN conference coming up Friday, February 28th and Saturday, March 1st in beautiful Miami, Florida. And I say this to everyone. I know for many of us in this health space, the last thing that we think of is Miami. That is a place that's in alignment with what we do health-wise. I promise you, Miami becomes highly desirable in late February and early March, where it's cold where you live, and it's 80 and sunny there. Check the weather there. So we'd love to see you guys. It's biohackerexpo.com, code HDP, like Health Detective Podcast. That's biohackerexpo.com, code HDP for 50% off tickets. I can't actually believe how many people we've seen come through in the last week. Our mixer is sold out, but you still have 2 days that you can come hang out with our team. We got Reed there, myself, Elizabeth Gaines, our education director. It's going to be a great time, and it's only about 2 weeks away. So I'm looking forward to getting to meet some of you for the first time. As for our guest today, let's get into this. Again, super important topic. Believe it or not, in 400 episodes, we don't have a ton of people on that actually talk about cancer. And I think there's a few reasons for that. It's one, because I have a lot of discernment around it. I want to be careful when we're bringing someone on to talk about this. I want someone that's highly credible, like our guest today, because cancer is very sensitive. When you get that diagnosis, I've never experienced this, thank God, but I've seen it in family members, unfortunately. When you get this diagnosis, there is this, I would imagine, kind of this lingering time bomb over your head where now you feel like, hey, I not only need to take action fast, I need to take very specific actions. I don't have a lot of room for error. Whereas those of us, not always, but a lot of us with autoimmunity, so I'm speaking for myself, I'm not speaking ignorantly here, I could mess up on some supplements. I could do the wrong diet. I could run a lab that wasn't really useful, and I'm still here. Not all autoimmune cases are the same, but I'm still here and I have the chance to correct versus if it is, some type of cancer, we got to make good decisions from day one. Ideally, prevention's probably ideal, but once you have that diagnosis, we got to know what to do. So with over 3 decades of experience as a naturopath, acupuncturist, and homeopath, Dr. Carroll specializes in integrative breast cancer care. Carroll's approach goes beyond symptom management, focusing on reducing treatment side effects, easing hormonal therapy burdens, and minimizing recurrence risk. Her unique emphasis on emotional wellness and trauma recovery helps women build the resilience needed to foster deep healing. And these strategies empower women to reclaim their health, vitality, and joy. Through her Empowered Against Recurrence live group coaching program, Dr. Carol has guided thousands of women to thrive post-treatment. Her mission is to provide actionable, integrative strategies that help women emerge from breast cancer stronger, healthier, and more confident in their journey to long-term wellness. Dr. Carol, thank you for what you do, and welcome to the show.
Thank you so much. I'm honored to be here.
All right. I know that you are a seasoned pro when it comes to podcasts. You got to humor me on this just because there's probably a bunch of people that will get to watch this that aren't familiar with your work yet. I always have to ask, how did you get into this? I feel like this is not something that people set out randomly to do when they're 5 years old. So there must have been something in your life that guided you to this journey. So how did you get here and decide that this is what you want to do with your life?
Well, in the 70s, many years ago, I was living in a spiritual community in New York, and my roommate had cancer, as it would be. And I went with her one day to Columbia Hospital, where the oncologist, and she was in her early 20s, looked at her and said, "You've had a lot of radiation and there's nothing more we can do for you. Basically, you're not going to live." And I looked at her and I said, "That's not going to happen." So we started investigating. And this was in the day before the internet. So you can imagine what it was like in the mid 70s to try to find an integrative holistic doctor in New York who, when you called them up, said, "I have, cancer." They didn't hang up on you. And she ended up finding this chiropractor who did a very unique form of diagnosis called iridology. And iridology is when you look at the eye and it's mapped out and all the different organ systems are in the eye, and you can use that as a system to help somebody detoxify. And in the 70s, the word detoxify was not so common or a household name like it is now. So she started seeing him, and then everybody in my community started seeing him, and we were all doing juicing and blended salads. And then I started working in his office. And this is how naive I was. This young girl came in with bad skin. And I'm sitting there. I didn't say this out loud, thank goodness, but I'm sitting there thinking, "You have bad skin. Just take antibiotics, tetracycline, 250 milligrams 3 times a day. What's the big deal?" And, but no, she went on this detoxifying diet. She lost a whole bunch of weight. She came back the following month. Her skin was better. Her energy was better. And I saw this time and time again with everyone that he had been working with. And he treated people with cancer. And he got into a lot of trouble with the FDA. He was hounded by them. But my friend started spitting up this black stuff in her lungs, and she took it to a lab, and it turns out it was some of the byproducts from chemotherapy and radiation. And at that point, I was really hooked. I mean, that was my introduction and my education into the beauty and the power of natural healing. And I had been planning on going to medical school, but one day I was going through this big pile of papers, and I took off a piece of paper, and there was underneath that the catalog to the National College of Naturopathic Medicine. And in that second, like the light bulb went off, and I said, "Oh, I need to go here." And so I started school there in 1979. And it was before naturopathic doctors had the ability to write prescriptions. So everything was herbal medicine and physical therapy. And I began to study homeopathy there. And I graduated from there, and I got my acupuncture license in California. So that was many years ago. And then my dear friend here in California developed breast cancer. And I accompanied her through her 18 months of chemotherapy, radiation, surgery. And I got an up close and personal look at what the discord was and the disconnect between natural healing and medical oncology. And it was like you're getting chemotherapy and around comes the candy cart, literally. Or you're finished your infusion. Would you like a cupcake or some candy? So let's get into the fact that cancer is a metabolic disease. There is this philosophy, or this scientific, I should say, scientific discovery in 1918 by the German scientist Otto Warburg, who discovered that cancer cells, given a choice between glucose and oxygen for what I call the cancer gas tank or the ATP mitochondrial system, they will always choose glucose over oxygen, even though they have to work many times harder and get significantly less ATP or energy. So here you are, you're trying to kill cancer cells with chemotherapy, and then you're feeding cancer cells with sugar. The whole thing was just mind boggling. And I began to take care of her using what I knew from my naturopathic and Chinese medicine experience. And one day we were in her oncology appointment, and her oncologist looked up at her blood work and said, "Well, what are you doing?" And I explained. I thought maybe there was a problem. And she said, "This is not the blood work of someone who's had 4 chemotherapy rounds. And I don't know what you're doing, but I want all of my patients to be doing it too." So my practice, which had been around providing integrative and functional care to women in general, and I did a lot of fertility then also, began to focus exclusively on breast cancer. And being a member of this Mindshare community, I developed this online program to bring my skills and my perspective and this really critical information. I call it the other side of what women need to do to address their breast cancer, because medical oncology treats the tumor and then it stops. And so what is a woman to do? Because first they've had chemotherapy and radiation and surgery, some combination of that. And then they're put on hormone blocking medication, which is its whole other symptom, side effect, difficult moment. And then they ring the bell and they go bye, and they don't feel well. And how could they not feel well? Because they've been through many, many months of aggressive treatment. Their gut is totally destroyed from treatment. Their emotional wellness has been stretched beyond what they thought was possible. And as you said, it is a serious chronic metabolic disease. And there are many complicated pathways and factors that go into creating breast cancer. So in that it is a metabolic disease, there isn't just one thing that goes towards the contributing factors of a diagnosis of any metabolic disease, such as an autoimmune, thyroid, colitis, migraine headaches, Crohn's disease. It's a complex series of events. There absolutely is the genetics for breast cancer or any cancer. And I always say that there is an emotional component to any chronic disease. So when I first started working with women, as part of my 5-step program, I have a chapter or a week on recovering from the trauma, not just of breast cancer, but in the past. And one time I said to a woman said to me, "Well, I've never had any trauma." And I said, "Okay, first of all, I personally think that's sort of not possible. As an older adult, you have to have had something happen in your life." And I said to her, "So if we take away the word trauma and we use upsetting experiences instead, do you have anything to say about that?" And she goes, "Oh yeah, I've had a lot of those." And she proceeded to tell me many traumatic events. So this is where I like to share the approach of women who've had a diagnosis of breast cancer. And this is where I bring in my homeopathic experience. There is in homeopathic medicine this philosophy of the miasm of disease. And the miasm of disease is that certain diseases have energies to them, and cancer is one of them. And breast cancer has a very specific miasmatic energy to them. And I'm going to describe it. And when I do this in my webinars and my masterclass, women always say, "Oh yeah, that's me." So as I'm saying this now, and if you're here live or if you're watching this later, see if this resonates with you. There's always this rushed feeling, and you always feel like you have to do this and you have to do that. You like to make lists. You're somewhat of a perfectionist, so you don't like to ask for help because nobody will do it as well as you can. And there's always this issue of you're taking care of other people and saying yes to the point where you don't have any time or energy to take care of yourself. So the other component of this is the frog in the warm water syndrome. And what this, unfortunately, when I was in junior high, we did this as a science experiment. And right now, I don't think they do it anymore because it is animal torture. But if you take a frog and you put it into warm water and you gradually adjust the temperature of the water up, the frog will boil to death. So women who have had a diagnosis of breast cancer, a lot of them have multiple series of stress and trauma and impossible living situations and financial stress and work stress and illness of loved ones where they're taking care of other people, and then they get a diagnosis of breast cancer. So I say that breast cancer is a metabolic disease, and it's also a disease of the feminine. So in my program and my approach, I don't use the word we have to fight, attack, or conquer. It's not a battle, because those are inflammatory words. And then who are you doing that with but yourself? Breast cancer is a metabolic disease of the feminine, and it needs a feminine approach. And I'm an integrative practitioner. I believe in taking the best of both worlds, what medical oncology has to offer and what evidence-based integrative and holistic care as your FDN community utilize. So we like to test, we don't like to guess. And advanced integrative testing is a big part of what I like to do because, unfortunately, oncologists don't even run a vitamin D level. And there is an enormous amount of research that talks about how a higher level of vitamin D not only will decrease the amount of muscle pain a woman has from hormone therapy, but it actually decreases the cause of death from any cause, from any illness. So it extends your life. So I like vitamin D in my community to be between 55 to 90. I've had women come in with vitamin D levels of 12 or 14. Their oncologists want to give them 50,000 IU vitamin D a week. And that is a stress on the body. I like to have not the bull in the china approach. So that's a little bit of a long introduction to how I came to do what I do now.
Well, okay, there's so much I want to dissect here, and I'm sorry to go to just one
Sure.
relatively to everything else you said, small point at the end, but that was fascinating to me. You called 50,000 IU being a potential stressor. Can we talk about
Yeah.
why that level of vitamin D supplementation would be a stressor? That just totally got
Good.
me.
Happy to. Vitamin D is a fat soluble vitamin, right? D, A, K, and E are fat soluble vitamins. So fat soluble vitamins require more energy from the liver. And the liver has, for women who've had, or men who've had chemo or radiation, is already stressed out. And then for women, they're put on perhaps maybe tamoxifen, and that needs to be broken down by the liver. And many women are on statins, which also have to be broken down by the liver. And the CYP2D6 enzyme is required for that. And some women and people have a CYP2D6 enzyme deficiency, and they don't even know it because the doctors don't test for it. So then you add 50,000 IU of a fat soluble vitamin D, and it's like too much stress. So you don't need to give such a high dose all at once. You can start with a smaller dose over extended period of time. And as always, as your community knows, we always have to optimize the health of the gut. So doing a GI map or Genova diagnostic gut test to find out what's the baseline, where do we need to start as, to heal the gut so the nutrients can be absorbed.
Okay, thank you for humoring that because I was like, I gotta get to that last point because I actually never heard that. That makes total sense to me. So let's go back to these kind of overall bigger concepts here. I love that you mentioned Dr. Warburg because it's actually been, I would say, at least a year since I've heard that name. You know how we all kind of go through our different phases of learning different things in this space. So I got on a huge kick with him at one point, and I was just fascinated by it. Now, for me, like a lot of people in this space, so much of my learning, admittedly, was selfish in the sense that I only learned the things that were relevant to me at a given time. And thank God, again, I've never had to deal with this. So when I got along his work, I thought that was interesting. And then I forget the researcher off the top of my head. I believe it's Thomas something, but there is a whole textbook called Cancer as a Metabolic Disease, which is just fascinating in and of itself. So what I want to ask, and I hate to get into a question that's going to almost force you, I guess, to give an opinion, but I think it's worth asking. it's one thing to come up with the idea of how the trauma is all connected to this. Now, I am aware, because we've had people on, how trauma can affect disease states, but I can at least understand how an oncologist might say, well, yes, something that happened to you as a kid is not necessarily leading to this now. I don't agree with that, but I can get why they might think that. But when we're talking about harder scientific data, stuff as basic as the vitamin D levels, the 30 nanograms that you need, and that reduces all-cause mortality, and most people are walking around deficient. Like stuff like that, that is objective. We could argue it and win on a debate stage. I don't believe that the average oncologist is bad, and I know you don't believe that either. So I kind of wonder, how can these people that are so smart, why is this information not a part of the typical care that someone gets when they're dealing with cancer? Because I did have a family member that not only had cancer, they passed away from it. And they were at some of the best doctors that you could possibly go to, because they were thankful enough to be able to access them. And never once is diet discussed. I didn't say stop chemo. I didn't say stop the surgeries. It's just like, why would that not be advice that's added in? Do you have an opinion on why this isn't talked about with the patient?
I absolutely know why. Every beginning of December is the San Antonio Breast Cancer Symposium. So this year I attended virtually. I attended, and thousands of oncologists from all over the world come to this. Breast cancer oncologists and doctors and surgeons. It's all about breast cancer. And why is this not, why is diet not part of it? Because every single plenary session, every single presentation was all research based. And who funds research? How many hundreds and hundreds of thousands of dollars is needed to fund a research? What's the big, huge number of people that go into creating the proposal, doing the drug trials, figuring it out, getting it FDA approved, taking it through phase 1, phase 2, phase 3? That's why it's all drug. Now, unfortunately, even in a lot of major oncology centers have what they call integrative perspectives, and they have a nutritionist on staff. I can't tell you how many people have come into my program, and when I teach the week on nutrition, they go, well, my doctor told me I can eat everything in moderation. And my response to that is one of the worst things that you could be told. So you can't, it's not like you can't, it's like you need to be educated equals empowerment equals choice. So it's not like, oh, I can't eat that. Because if you keep saying I can't eat that, you're going to get resentful and upset. And the next thing you know, you're eating an ice cream cone. You have education. You understand that when you eat certain foods, you're spiking your blood sugar and you're giving cancer cells potentially a free ride. And that's why cancer is a metabolic disease. And the person who wrote that book is Dr. Nasha Winters. She wrote this. Yeah, okay. She's a dear friend and colleague of mine. So, yeah. Anyway, that's why. I mean, nutrition is the foundation, in my opinion, of recovering your health from all disease. And even if you don't have a disease, if you're doing the standard American diet, research has proven that is quadruples the cancer rate. And our society, if you look at the television ads, which is how we are all brainwashed in our society, there's an obese man and he's eating this juicy triple burger with cheese and bacon and it's dripping him and he's taking Tums. I mean, and he literally has a huge abdomen. So what is the message? You know, there's a messages for people with psoriatic arthritis and severe Crohn's disease. And they always have them sitting around eating gluten, a sandwich or something. I mean, it's very interesting when you become aware of the messaging that we're getting through American advertising about, you don't need to change your diet if you have psoriatic arthritis or severe Crohn's disease. It's okay if you eat ice cream and, bread and sandwiches. That's not okay. From a functional standpoint, that's one of the first things that need to go out, right? The gut contributes to the lung, contributes to inflammation. The gut and the large intestine are connected. It contributes to inflammation that contributes to disease. So gluten is a thing of the past, hopefully.
Yes, for some of us. I like that you talked about what happens with this, because it's not that there's not science behind this, it's where does all the funding go into. And I'm so hesitant to say things like this because I know that we're going to attract new people with every podcast. So guys, if you're not a regular listener, I don't get political on this show. That's not even what we're about. But I will say, and quite frankly, you have no idea what my politics are. It's probably not what you think. There is one statement that I hate probably more than anything else that's come out the last 4 or 5 years, and it's somehow been politicized. And it's this idea of trusting the science. I'm okay with that. I like that idea. The issue is, what science are we talking about? Do you mean actual stuff? Are we talking about all the science or just the stuff that gets shown on your TV every single night? Because if we're all following the science, I've been wearing like the blue light blocking glasses at night for years now, probably 7 years. If we were all following the science, well, for over 10 years, the University of Toronto already showed that those make meaningful differences in melatonin production and sleep quality. So that's science. But it's amazing. I go out and wear those, and I'm the only one, and I look like a freak wearing these red tinted glasses at night. So following science, I'm all for that. But it seems that this has been tainted somehow, where it actually means, no, follow what TV say good and what TV say bad. And the issue is, to your point, what gets on that TV and what gets promoted to the average consumer or patient is a very select amount of science that is relevant and useful in its own way, 100%. But then there's all this other stuff out there that these patients never get to see. And it was so, I want to be vague, but she didn't share her story publicly to some degree, so it's not really my place to share. But again, I'll just say a family member dealt with this. And Dr. Carol, this was one of the smartest people I ever met. And I mean that literally. She was actually so brilliant that she was tested as a kid for her IQ. It was over 145. Wow. And that was about as high as that test in the school went. So for those that don't know, you're talking about a person that's anywhere from 1 in 500 to 1 in 10,000. It's a brilliant individual. And I'm like, this is not a dumb person. But the fear that they imposed to her when she got this diagnosis, it's so like, glad you brought that up. And you want to be respectful as a family member. She's already dealing with enough. And I don't need to be sitting there banging on her phone every single day trying to tell her my opinions on stuff. And I'm not an expert in cancer. It's not really my place. But what I couldn't understand is this idea of how on earth can we think it's a good idea to be doing all these stressful things that you're doing to your body with the traditional methods, which fair enough. But then on top of it, drinking red wine, eating candy, crappy white bread. I'm like, how on earth could anyone think that that's a good idea? So I don't want to turn this into a venting session. That's not my intention, but it's like, I feel sometimes like everyone else is drowning around you and you're like screaming like, hey, we have a life vest right here. Just hop on. All you got to do is grab it, and no one sees it sometimes. I just do not get how this is not obvious, even if there wasn't science behind some of the stuff that we're saying. Like, why would it not be clear that it's not a great idea for someone with cancer to be eating processed foods? Like, there's such a disconnect.
Let's talk about the fear that's instilled in women and how they're addressed. And I'm going to be a speaker at the upcoming Beljanski Integrative Cancer Conference in Austin at the end of April. And my topic is the mindset and the wording of cancer. And in cancer is, when you say the word cancer, people think of the word as a noun, but I think it's a verb. Because cancer, very simply, are cells that have decided to stop paying attention to the normal, healthy rules of stop and start. And when medical oncologists, unfortunately, talk to women or people with cancer, I think, the word patience, that's part of the problem of the mindset of cancer. Because the whole perspective of, listen to this phrase, my doctor told me I'm going on, or my doctor said you're going to be taking this drug, or you're doing this form of treatment. It's a passive, you're being told what to do. And I think that in order to be the author of your life, you need to be the head of the team, not, well, you're part of the team. No, I'm the head. And unfortunately, when you have a chronic metabolic disease, whether it's cancer or Crohn's or migraine headaches or infertility, whatever, you part of empowerment, and the name of my program is Empowered Against Recurrence. Empowerment is a very important word, is education. So it's no longer okay just to take the car to the mechanic. You need to find an integrative practitioner who's going to take the time and has a program to educate you. So when you have, for example, if you have a certain type of breast cancer and you have an onco score that's a low number, which means you have a low risk of it coming back, but they want to do radiation just in case anyway. And you've been educated and you understand that radiation creates an enormous amount of oxidative stress. It can create lung and breast fibrosis. It can create more aggressive cancer in the opposite breast. And so you've been told that if you do radiation, you can have a 6% reduction in your risk of recurrence. And you're educated and empowered, and you say, you know what? I'm not going to do that. I'm going to take my knowledge and my skill set, and I'm going to start doing foundational nutrition, targeted supplements, talk about the stresses and trauma I've had in my life, develop healthy and toxin-free homes, start on an exercise plan. As we get older, one of the best things we can all do, no matter what illness or what level of health we have, is to replace fat with muscle. So much of the standard American life is not about maintaining health, optimizing health and long-term wellness. It's about being passive, sitting and watching television, and being on our social media. I think this whole thing that we've gotten into is very destructive for our physical and emotional well-being, and breast cancer is part of that. So I like to refer to breast cancer as your psyche saying, knock, 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 hi. There's stuff going on here that, you have to pay attention to. I know you've been really busy with your family and your work and everything else, but now you really need to pay attention to it. And it's not just your psyche, it's your body too. All chronic disease involves your mind and your body. So to have true healing, we need to really open up our beings and our souls and our minds to, well, what's not working in my life from an emotional perspective? And what kind of habits have I gotten into that aren't in my best health interest?
Yes. I love that we keep coming back to this idea of, like, we have such, technical stuff with the glucose and how the cancer cells can favor that. And then this more, I wouldn't say not technical, but a bit more obscure for the average person of like, oh, there's a huge emotional component here. There was evidence of maybe some, I don't know if abuse is the right word, but this person that I'm referring to in my life might have had a lot more that happened to them than they ever revealed. But what I found, I'm losing a better word for this as well. I don't want to say interesting. There's nothing interesting about it, but noteworthy about their diagnosis as well is that, they were over 50 years old, and this diagnosis happened within about a year or two of their father
Somebody
passing
dying. I
away.
was going to say somebody,
And
parent dying or
yeah,
somebody dying.
yep. So do you see that a lot? Like, you see these types of things where it's like, right, even if they don't call it trauma, these very big emotional stressors come up. Does that seem to be par for the course with most women who get breast cancer?
Well, I wouldn't say, breast cancer is a huge topic, but it's not uncommon
Sure.
that a couple years after a big event, such as a parent dying, or you have to move out of your house, or a divorce, um, this comes up. But there were metabolic pathways set in line before that. And, but it's not uncommon. I hear it a lot. A woman had a very stressful couple years, and sometimes she'll start her initial interview with me by saying, well, I know why I have this. I know why it happened. And so we have to, it's a process. Health and healing and wellness is a process. And the first thing that needs to happen is you have to forgive yourself for all of that. We can't control on certain levels what kind of physicality happens to us in life. What we can control is our choices of how we move forward. And I just saw that somebody said that when she said no to her oncologist about a certain form of treatment, they got angry with her. That's a moment to say goodbye to that doctor. It's your choice. And the doctors, with all due respect, they are controlled by the standard of care, and that standard of care is controlled by the insurance companies and the research that's been done on it, that their medications and their drugs, and they want to treat all breast cancer as like within certain parameters, whether you have HER2 negative or whatever. It's by certain chemotherapy treatments and radiations, and two women can have the same gross type of breast cancer, but if you did some genomic SNP testing, you would see that they have different driving metabolic factors, they have different body types, they have different emotional responses to stress and trauma. So even though breast cancer is a huge diagnosis, no two breast cancers are the same. And because cancer cells are undifferentiated cells, one of the most important things that a woman or anyone who has any cancer can do is to differentiate your life. And what does that mean? It means getting out of the rut of standard American care and standard American lifestyle and really beginning to tap into your own passions and what you really want to do. And that's one of the things that I really try to help women with when they go work with me or go through my program is, what do you need to do to start feeling happy and joyful? And what little shifts can you make in your life to be healthier? So maybe, the standard American breakfast is not a healthy breakfast. And people come into my program and they go, well, I was told I need to eat oatmeal in the morning. Actually, you don't need to eat oatmeal. Even if it's steel cut organic oats, it's still a carbohydrate. And your cancer cells are very hungry. So when you eat a carbohydrate, they go, oh, great, I'm going to get gas for the cancer gas tank. So how do you eat breakfast in the morning? First of all, if you're not doing intermittent fasting, which you can several times a week, protein and fat and vegetables. We've been brainwashed in America that breakfast comes out of a box with sugar cereal or oatmeal or, God forbid, Pop-Tarts or waffles or whatever. That's, other cultures don't do that. So leftover dinner can be breakfast. I mean, we need to reimagine how we start our day. And I think that's a very important component of healing after any serious chronic illness. It's the same for autoimmune disease, right? You don't want to start eating your day with carbohydrates and sugar. You're not going to feel well.
I see a lot going on in the chat here. This is kind of a rare time I would do this, but forgive my videos moving around. I'm actually going to turn the chat overlay on just so other people can see this, because we're not going to, sorry guys, we're not going to be able to get to everything in the chat today, but it also makes it easier for Carol because then we can just see it kind of with each other or next to each other's videos. And so one thing I wanted to definitely ask today, if you guys have any questions, throw them in the chat. But one thing I wanted to make sure I got to by the end of this was, we talked about from the get-go this idea of cancer, or breast cancer specifically, but probably a lot of cancers, being a metabolic disease, and how these glucose can fuel the cancer cells. So we have an audience that ranges greatly. You have some people on here, Dr. Carol, that, man, you'd be like, they've been in this space for a while and they could talk the talk with you. And then others are brand new to it, and we welcome all of them. So it's not a condemnation to the new people. But what I'm hesitant about is I'm thinking with the new people, they're going to hear something like that and be like, oh, okay, I need to just go keto then, because then I'm just eating proteins and fats and, I'll be fine with my cancer because it's a metabolic disease and it thrives off glucose. I could be wrong. I would guess even if that's helpful, it's not that simple. So can we kind of dissect that? Because I'm guessing that's probably not the only solution or even a solution.
I'm sorry. So what's the question about?
What I'm worried about is knowing our audience and thinking, like, if they hear that glucose fuels this, a lot of them are very much in the carnivore keto space. So they might say, well, if I just do that then and I don't eat sugar, the cancer will go away, or I won't get any. And I'm just imagining it's not that simple.
No, it's not. No. If I was coming across that, I was saying that it was that simple, I really apologize. No.
It's sorry. And not to cut you off, it's not you. It's the fact that we get people who we attract in the course. Sometimes they are people, they might be working as accountants. This is the first thing they've ever done in holistic health. So they're brand new and they're getting bombarded with all the ideas that you got to see 30, 40 years ago. So it's not you at all. It's just me being smart with our audience.
Okay. So yes, it's not just one thing that created a diagnosis of cancer or any metabolic disease. And it's not just one thing that a person needs to do to recover their health. So let's get that straightened out. But if you don't mind, I just want to say that
sure,
there are naturopaths, which I am a naturopath myself, and oncology is a specialty. So I have worked and done consulting with people who are seeing other naturopathic doctors, and with all due respect to those doctors, it's in your best interest also to work with someone who has specific oncology experience. Because and Jamie said her doctor was scratching her head and didn't know what to do. I know what to do with that information. And oncology based doctor, whether they're a medical doctor, an osteopath, or a naturopath, would know what to do with that from osteopathic perspective. And Sarah was told not to use too many antioxidants during chemotherapy. And in my approach, I actually agree with that. But if you're on a 3-week schedule, what we do with your supplement protocol is 2 days before your infusion and for 2 days after, we adjust, because the antioxidants are water based. So you get rid of them in 2 days. You have your infusion and then you wait for 2 days and you start back on your supplements. So you have the rest of that 2.5-week time to really support your body. And that's how I worked with my friend when she was going through her treatment. And that's why her blood work was so positive. But I want to be respectful of medical oncology. I don't ever want oncologists to say to me, well, this person's treatment didn't work because they were on your supplements. I've never had that happen because I know how to adjust the protocol so that it doesn't interfere with your medical oncology treatment. Okay.
Yes. So just the rest of it was just conversation. Jamie had said from the beginning, I'll just read this out loud. Thanks for your patience, Jamie. They've been in the wellness space for 20 years and consider themselves to be one of the healthiest people that they know, with literally no other issues, and live a wonderful life. But they had mastitis. Am I pronouncing that right?
Mastitis.
Thank you. 10 times in the same spot, and just got diagnosed with stage 1 last May. 4 surgeries, no chemo or radiation, and already stopped taking the tamoxifen. Yes, I got that one because it felt like it was destroying my body. So it looks like they're in FDN. So Jamie, we're glad to have you, but that is kind of crazy. Do you have any thoughts about how could they be doing all this health stuff and then it comes up that 10 times in the same exact spot?
So, first of all, with that type of cancer, Jamie, there is something called the Italian study. And if you were given tamoxifen, you should have been given 5 milligrams a day. And if you weren't, that's something to go back to the oncologist, because now finally the oncologists are beginning to do some dose differentiation studies. So the standard of tamoxifen is 20 milligrams, but with the type of cancer that you were diagnosed with, there is something called the Italian study. You can look it up in PubMed or Google it, and you will see that it's 5 milligrams. And what they're looking at to see is a lower dose of tamoxifen going to have the same outcome. But tamoxifen is a very intense medication. It creates an enormous amount of oxidative stress, and it is anti-estrogenic on the breast. What it does is it goes to sit on the breast cell receptor, so that when estrogen goes to bind to that breast cell, tamoxifen goes, too bad, I got here first. So it's anti-estrogenic on the breast, but it's pro-estrogenic on the endometrium and the uterus. So there's a very high risk of endometrial and uterine cancer, which is why if anybody is on tamoxifen, you should be getting every 6 to 12 months vaginal ultrasounds to check the lining of your uterus and to have a look in there. And if your doctor is not recommending that for you, then you need to say, hi, I think you forgot something. And either you get it through your gynecologist, or you see an oncological gynecologist. I have my whole program. Part of this big chapter in it is, I call it the special workshop, and it's about reducing the side effects of tamoxifen and aromatase inhibitors. There's a lot to be done about that, because you have to have quality of life, right? And they're very destructive. It puts you through speedy menopause, and there's a lot of side effects from that. So anyway, go ahead.
Yeah. So, all right. Well, I want to talk about your program. I have one other question before we kind of lay it out, like exactly who it's for. Is it for just people once they're done being diagnosed, or once they're done treatment? That was a silly way to say it. We'll get to that right after this. The only other thing I wanted to ask is, so for our guests that are new, I've mentioned this a few times. We send a sheet to our guests and we try to get the 3 main points that they'd love to get out if they can't get anything else out on the show. And the third thing that you listed is the most important change to make once diagnosed? And this teased even me because it doesn't tell me what that change is. So if someone gets diagnosed with breast cancer, what do you believe is the most important change to make?
It's in your mindset. It's understanding that you have much more control over what's happened and what is happening than you've been told, and to really bring together a healing team. The healing team is just as important as the medical oncology. And who is that? It's somebody such as myself. It's an acupuncturist. And I find people, local acupuncturists all over the country to refer you to. If you email me, you go to my website, carollourie.com. If you use the contact me form, and if you want me to find you a local acupuncturist, just put your zip code in there and I'll respond. It's an acupuncturist. It's a massage therapist. It's, going on YouTube and finding 2 different forms of exercise that you enjoy that you can easily do. If you ask me to go swimming or ride a bike, it would never happen. But I love to do my power walks up those killer hills, and I do weightlifting. So we all need to do 2 forms, and I do an hour 6 times a week. So it's not like 3 times a week. Unfortunately, I don't want to be flabby. I want to be, muscly. I want to replace that fat with muscle. That's what I want to do for my health. So I think in our society, mindset, it's very important. The mindset is critical, and bringing together your healing team. And that's true for no matter what illness or disease that you were diagnosed with. If you feel like you're healthy, that's great. But as you age, the little things that, you got away with because you were younger, they're going to creep up. So, and you're all here in the FDN community. So that's great. Use that functional lab testing to see where you need to bring in some help for yourself.
In terms of your program, what I'd love to talk about now is who this is best designed for and suited for. Because if I'm a listener, I might not know yet. It's like, all right, maybe I just got diagnosed a week ago. Maybe I am post-treatment and I've never felt the same since. We've had so many people I've talked to that went through the treatment, and thank God they are cancer-free as far as they know, but now they got a whole new slew of problems that they have to deal with. So which audience do you serve? Do you serve both types of people? I'd love to talk about that. And then what can they expect if they were to work with you?
Well, the name of my program is Empowered Against Recurrence, but I also have a program called Empowered Through Treatment. So I work with people from the minute they were diagnosed through when they finished, when they've rung the bell, and then they're placed on hormone therapy. And sort of that's when the real pain starts, because when you're going through treatment, you're starting on day A and you're stopping on day X. But when you've given a hormonal blocking medication, and as one woman here said, she took it for a short period of time and stopped taking it, and the side effects are ruining your life, it's very hard. And the doctors will put the fear of what into a woman if she stops taking it. So that's when you need another little voice in your head and some skills. So the Empowered Against Recurrence program is a live group coaching program, and you get a library of material, and then you get to meet with me once a week. And the Empowered Through Treatment is you get a library of material, and then you meet with me with a concierge plan, because you have, and that's offered also for women post-treatment, because some women need, if you have metabolic and you have genetic or driving factors and you're not well, the program gives you an overview, but you need really individualized support.
Gotcha. And obviously you guys can see it on the screen. You can find her at carollourie.com. I'm just so glad that there's people out there doing what you're doing. I feel like as we produce more and more FDNs, we have like a whole army, and other people in the functional space. We have a whole army of people that end up really helping the autoimmune community. I find a lot, not even necessarily that we intend to set out on that, but I find that that is a community that is this, unfortunately, perfect intersection of mystery symptoms that last forever and not getting served properly by Western medicine. But oftentimes they have some time. Like, you could kind of get screwed by Western medicine with a lot of autoimmune diseases for 5 years, still be alive, do all this functional stuff, and then get well afterwards. And I speak with that from experience. My mom went through that. It took her 7 years just to get diagnosed, another 5-6 years of hell with treatment. And thank God we're able to get her with the functional labs afterwards. And she's in the best health that she's ever been now at 50 something years old. that's amazing. That's not always the case with the cancers, and certainly the fear that gets put into people's minds the second that they get diagnosed. I like that you brought that up, as I often wonder how much that has to do with the speed in which things seem to get bad for people. They start getting the surgeries and they start getting on chemo right away, and then they're so banged up after a year or two of this process that it's like, all right, well, what is this, the chemo? Is this the cancer? Is this the stuff that they were doing leading up to the cancer? It almost gets very hard to tell how they ended up in this state that they're in now. So I'm just glad that there's people out there doing what you're doing, because I don't think we have anywhere near enough of you
Thank
yet.
you. It's impossible to get through cancer and not feel horrible. Let's just say that. I mean, when you've been through some version or combination of chemo, radiation, and surgery, your body and your psyche have been through so much. And when it's over and you've rung the bell, which I think is a very mixed ritual, everybody thinks, oh, she's going to get back to normal the way she was before. And the way you were before is very different than you are now. You've been transformed. You're physiologically depleted, and you're emotionally stretched beyond. So there needs to be, it's like sort of, when veterans come home from war and they go right back into society, all of a sudden they realize they have post-traumatic stress. There's a boot camp before they get shipped out. I think there should be a recovery camp when they come back. So it's sort of like the same for women and men who have gone through cancer treatment. I mean, you're not yourself, and you're physiologically depleted and exhausted. You're emotionally stretched, and there is a lot of fear. And then you're placed on hormone blocking medications and you feel horrible. So there needs to be a higher level of support. And one of the things with women is you expect that you can do it yourself. Oh, I'm just going to power through. I'm just going to, go onto Dr. Google and read this myself. It's very complicated. Creating a cohesive supplement protocol. When I do my supplement reviews, people think, oh, it's really easy. I can do this myself. It took me years of studying with some advanced oncology practitioners. We have a whole community, and to make it look easy. And that's sort of like when you go to the Olympics and they do their thing, and it took millions of hours for them to be able to do that. So it's the same thing with what you're going to be doing as FDNs. And what I do. I mean, it takes a long time, and I really want to encourage women, don't try to do it yourself. Even if you only do a few hours of consultation with somebody who's really an expert, give that to yourself as a gift. It's the best time and money that you can spend. And then if you want to go into oncology yourself as an FDN, there is a large need for you. And if you're interested in that, you can reach out to me, and I will can provide you with some referrals to learn more after you're done with your FDN studies.
Oh, thank you. That's okay. I will make sure to keep this in the back of my head, because that actually comes up quite frequently. And there's only one FDN out of all the ones that we have. There's only one that I think of immediately when I think of cancer. And there's so much that goes into it, right? She's connected with certain oncologists and connected with this person and that person. You're never really going to be a standalone FDN that does the cancer stuff. You're always going to have, you're going to have yourself integrated with the team. And so I will absolutely be sending people your way. This is between yesterday's podcast, guys, and today's, this is just two back-to-back guests where 50 minutes is nowhere near enough. If you liked this today, one, please just put a thank you in the chat. I have such a respect for people that are doing this for decades out there helping people, and it doesn't seem like they're stopping anytime soon. The will that takes.
I'm very grateful.
Yeah, and yeah, that's what I'm saying. And the passion behind that is just so freaking cool. And the number two, even if you guys aren't dealing with cancer, I hope that you aren't, throw Carol a follow. She's got Instagram. She's got all this stuff. You can find it on the website. We need people like her getting boosted in people's feeds. I'm tired of seeing half-naked dudes and gals on my feed as a 29-year-old. I want to see Dr. Carol's stuff, talking to me about something good that I can share with my family members that actually helps them. These are the voices that should be getting promoted on social media, with all due respect to people making their money off being Instagram models and stuff like that, both guys and gals. My final question for you today, this is a general question. It might go back to the same answer with mindset, and that's fine. But even just forgetting cancer for a second, the signature question on the show is a general one about health. And it is, if we could give you a magic wand, you could waive it and you could get all of our viewers and listeners to do one thing for their health. So that means you can get us all to start doing one thing, or you can get us all to stop doing one thing. I would love to know, with your experience, what the heck is the one thing that you get us all to do?
Love yourself more. That's it. I think how we all talk to ourselves in our head, especially as women, it's we're not enough. We didn't do this right. We're too much this. We're too much that. And I don't think people pat themselves enough on their back. And today's Valentine's Day, so it's about love. And I just when I did research for the email that I sent out for Valentine's Day, and I'm not going to go into the details, but how Valentine's Day started was around horrible violence many, many hundreds of years ago. It was very interesting that now it's turned into this day of love. And if you are interested, you could Google how did Valentine's Day start, and you'll get the story. I didn't even include it in my email because it was too horrible to talk about. But here we are on a day of love, and I don't think we don't love ourselves enough, men and women. And the energy of self-love and telling yourself that you're great is very different for your cells in your body. It creates healing and wellness as opposed to stress and inflammation. And inflammation is the foundation of all disease, no matter what it is. So if we love ourselves more, no matter what the illness is, we'll all feel healthier and be healthier and feel happier and have more joy in our lives. So that's what I want to